Hey, I'm Dr. Durham, and I wanted to make sure that we answered a few questions that we typically get on first visits or early in patient's care. One of the things that folks want to know is, what should I expect after I get adjusted? How should I feel, and what should that experience be like? And the truth is, it varies from patient to patient in a lot of ways, but typically you should feel a little bit looser, a little bit more mobile, a little bit more comfortable. If you do experience some soreness, it may be that we've had a release of some bracing patterns or some adaptations that have taken place mechanically, so you can always use some ice or heat at home on that, and we can give you instructions to do that. It's typically a nice experience. We do several techniques. The main technique that we do is a release type technique with an adjusting instrument. We also do a manual technique. We do flexion distraction work, drop table work. We do an activator technique. These are all useful tools, and that's all they are, is tools. After your first adjustment, you should notice some improvement. We tell patients in a typical care plan that their symptoms should be at least down to half within the first 2 to 4 weeks of their care. This obviously is not set in stone for everyone. Sometimes, matter of fact, most often it takes place a little faster than that, but we do like to under-promise and over-deliver. We want to make sure our patients get a nice experience and good results with their care, so this is just part of our approach here in our office. The therapies that you'll experience are there to reduce muscle spasm and inflammation. Inflammation is the basis of a lot of your symptoms typically. So with those inflammation sources, we'll discuss that, which can be something as simple as emotional stress. We have an increase in cortisol production that can feed inflammation pathways. We can have dietary problems where you're eating a poor diet, putting poor fuel into your body, and it's just creating metabolic inflammation. Also, what we deal with as a frontline problem, typically with chiropractic care, or mechanical disorders, which cause just mechanical wear and tear, kind of pulling type of irritation that is a source of inflammation. So inflammation control is a part of your care that we want to consider. It's not that you have an ibuprofen deficiency in your body and you need to take ibuprofen every day. We don't recommend medications, but we do recognize the importance of getting rid of the source of that inflammation, which, as I said, could be emotional stress management problems. It could be dietary, nutritional problems. It could be mechanical stress adaptations. So those things are all important to consider as we move forward. We want to first get your pain or your symptomology down to an acceptable level, and that's going to be something less than a 3 out of 10. So we want something where you get through your daily activities without a lot of alterations. This is more of an empowerment type of care and not a control type of care. So we want you to feel empowered and in control of your health, and we try to give you tools to do that. So we're going to try to minimize your symptoms. The next thing we're going to try to do is expand the available capacity for function. So we do that with stretching techniques, or we may suggest some yoga, and we have in-office practices where we'll coach you through that process initially, and then try to get you to take on more of that responsibility at home on your own and experience a more active and happy lifestyle. Once we expand that capacity, then we'll need to train that newly available capacity. That's where we can bring you back to feeling 10 years younger, is what we tell folks, and that's in a nutshell how you're going to feel by experiencing capacity that you've lost or that's insidiously just slipped away over the last few years. So we can bring you back to a higher level of health, higher level of function, and there's nothing magical to it. It takes work and it takes dedication on your part, and we want to assure you that we're certainly dedicated on our part to make that happen for you, as we do for many patients every day. So this is just a few things that you might be wondering about. If you have additional questions, you can check out our website, and you can also just give us a call or drop by for a visit. We're happy to talk to you and do consultations on any health problem you might be experiencing. Again, we're holistic healthcare practitioners here I'm a holistic healthcare physician here in the community, and we just want to promote holistic practices that will empower you to have a happier, healthier lifestyle. Thanks.